In a society where humor has permeated every discussion, the serious issue of mental health often becomes a tragic punchline rather than a topic of earnest concern. This reversal of priorities, where challenges are met with laughter rather than support, leads to a chilling paradox. Those in need of help are left vulnerable, dismissed as jokers or insane for seeking assistance. Imagine a student burdened by the weight of academic pressure, struggling silently while their reality is brushed aside as mere antics. In their search for relief, they are often directed to conventional medical practitioners instead of mental health professionals, misdiagnosed and prescribed medications that cater to physical symptoms while their true struggles remain unaddressed. This lapse in understanding not only strips away their sanity, but also fractures familial and national structures. So, where does this lack of sanity stem from? We must ask ourselves why problem identification is replaced with avoidance and superficial solutions. Why are discussions around mental health taboo, leaving individuals alone in their turmoil? If we could only prioritize identifying core issues and fostering genuine dialogues, we would be on the path to real solutions. The need for trained psychological therapists is more pressing than ever. As the world grapples with a multitude of mental health problems emerging from families, schools, workplaces, and places of worship, understanding and compassion should guide our reactions, not indifference. With every passing moment, the urgency to cultivate a society that respects emotional health grows. By fostering a culture of openness and education, we can begin to reflect on our collective mental well-being. Consider the absurdity of using inappropriate tools for a task, an axe to design clothing instead of the precise scissors needed. The analogy rings clear in how society treats mental health. We must match the tools for the job, advocating for trained counselors who can address these growing concerns. Mental growth may come at a cost, but the value of mental health far outweighs any economic gain. To navigate this convoluted landscape, we must reclaim our sanity as families and communities. The urgency to champion mental wellness and ensure access to appropriate support systems is not merely a personal issue, it is a societal obligation. We can catalyze change by demanding that higher education institutions prioritize training more mental health professionals, ensuring that eventual pathways toward healing become accessible and culturally relevant to all.